Hello, my name is Shia Ritchie, and I'm going to be counseling our client Jessica, a 28-year-old G2 P2 client who is coming in for concerns of a lump on her breast. So here we go. And here is my breast model. So the first thing I want to do is talk to Jessica. Hi, Jessica. And I'd like to ask you some questions. When did you first notice the lump? Has it changed in size, shape, or tenderness since you noticed it? Is it painful and tender? Does it feel smooth or irregular, mobile or fixed? Like, is it moving around when you touch it? Is it only in one spot, or are there other areas that you are noticing this lump? Any skin changes around that area, like redness, or like it's getting a little bit bigger? Have you had any recent trauma to the breast, perhaps an infection, a fever, even mastitis? A question I would ask before that is, are you still breastfeeding? Are you weaning? Have you noticed any breast changes related to pregnancies before, or maybe even your menstrual cycle? Are you using any contraception or other hormone uses? And so I'd like to then say I'm really glad you noticed this and came in. Because you are 28 years old, most breast lumps in people your age are benign, especially when they're found during self-touch exams like in the shower. But any new lump deserves to be checked so we can be sure. So what I'd like to do is look at your breast first, to look for something that may seem out of the ordinary to me, like a lesion or cracks or discoloration or a mass. And I'd like to feel around your breast, and I'm feeling for hardness or a lump or movement or anything like that. So what I'd like to do is I'd like to take my two fingers and I'd like to bring them around the edge of your breast, and then I'd like to move toward the center area and then just the middle around your areola. And if you could point out the area that you are feeling that lump to me, I will pay more attention to that area here. So I'm going to take my two fingers here. Do I have your permission? Great. So I'd be feeling around here, and I'm feeling for other lumps or masses. And then I'm also feeling around the area that you told me you feel in those lumps to kind of get a sense of what I'm feeling. Does it hurt when I push against it? It does, huh? And did you say that you were breastfeeding? You are breastfeeding. Okay. And you said you noticed this in the shower, right? Okay, understood. Okay. Well, I finished my exam. So here is what I'm assessing. I feel some tenderness. It's not very hard, but it definitely feels tight. And from how you're sort of wincing and the face that you're making, I can tell that it makes you uncomfortable to the touch. And I do know that you are breastfeeding because you told me, and that you noticed this in the shower. So altogether, here's what I am thinking. When we're in the shower, our milk ducts tend to swell up a little bit. It gets kind of like that, I wouldn't say inflammation, but that warminess tends to really exacerbate our milk ducts. So when we're in the shower, especially as breastfeeding people, we can feel like some tenderness and some enveloping of our breasts. And what I'm thinking is that you had some milk that hasn't been expressed yet. How have you been feeling? Any like feverishness or headaches or dizziness? Sort of feverish, but you haven't taken your temperature. It may seem like a little mild mastitis that you might have. What I would definitely recommend is a nice, gentle, but thorough massaging of that area. And try your best to pump as much as possible to see if you can relieve some of that. And also, I would ice the area as well. If that doesn't work and the pain gets worse and you feel like your symptoms have gotten a lot worse, I would definitely recommend visiting urgent care because these things can quickly turn into an infection and we do not want that. But I would definitely do your best to try to at home manually express your milk and take some ibuprofen as well for the pain and do your best to try to expel the milk on your own. But again, if anything worsens, you do have a high temperature, feverishness, dizziness, do not hesitate to go to urgent care, okay? And if you'd like, in the future, if any other concerns arise around your breasts, I can refer you for a diagnostic breast ultrasound. Um, 29 is a bit young for a diagnostic breast ultrasound, especially since there's no breast cancer related in your family. But this is for you, and if you want to do it, then I have no problem sending that referral out to you. Okay, Jessica, were there any other questions that I could answer for you today? Okay, well, you have my number. You call me whenever you need me, and I'll be on the line.